It's 9 o'clock somewhere, so I'm gonna call the October Surrey County Public Safety Committee meeting to order. Madam Clerk, we do a roll call.
James Linden,
Present.
Ron Buckles,
Present.
Ed Peters,
Present.
Dale Schleter,
Here.
Chuck Bennett.
Here.
Madam Clerk, are we in compliance with open meetings laws?
The meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Committee members, have you had a chance to look at the agenda? Is there any changes that you want outside of what's been publicly posted?
Looks fine, Mr. Chair.
Yeah. No changes. So we're at public comment. I have one person who's registered for public comment. Is there anybody else who's present, who's not on the agenda that wishes to address the committee? Who do we have online? Just Mr. Bennett. Ms. Layton, you have 3 minutes. She's gonna need access to a mic, somebody.
I thought I submitted my report in writing.
Oh, that's all you wanted? You don't want to address the committee?
Well, it says on that form that you will read it to them.
Read
I
it.
can
Put
if
it
you want me
on
to.
record.
All right, okay.
Right.
Kind of like Monday.
It is Monday. Oops.
All right, so I have a written submission from Louise Layton, 7442 West South 70 Ojibwa, representing herself and all residents and visitors to Sawyer County. The comment is requested policy be made to limit ambulance and staff leaving Sawyer County during busy days and days when resources are stretched. To facilitate reasonable coverage for all residents and visitors, is it in progress? So the comment's been received, and we'll give the ambulance director a chance to respond at that point. Anybody else here who wishes to address the committee? Hearing none, moving on. Number 6, a motion to consider the minutes for last month's meeting, for the August meeting.
I'll make a motion to approve as presented, Mr. Chair.
Motion by Mr. Buckholz,
I'll second.
second by Mr. Peters. Motion is to approve the minutes as presented. Any discussion on the motion? Hearing no discussion, call for a vote. All in favor of the motion indicate by saying aye.
Aye.
Any opposed? Any abstentions? Motion carries. Moving on to number 7, Circuit Court. The judge is not available. He's actually at a doctor's appointment. He called me before I got in here, which is why I was a little bit late. So there's no judge's report for this month. Mr. Hoff, the courthouse remodel update.
Thank you. Yes, we had a staff meeting with the architects and the construction manager on September 22nd. Items covered there were building security. We talked a lot about the locks on the doors and the card readers, electronic locks, and where they're placed and how the security flows through the building so that they can design all that. And then we also talked about the interior finishes and how that would be laid out. And all this is to further refine the information so that we can get a great estimate and get bid documents out later this year to people who will be building that facility.
Excellent. Any questions for Mr. Hoff? Chuck, any questions for Mr. Hoff on the courthouse remodel update?
I do not.
Moving on to number 8, Clerk of Court's office report. We do have a report that's submitted. Madam Clerk is present. Anything you wish to highlight? Add, sing, dance?
No singing, no dancing. We're happy we're down to 1 trial left on the calendar for October. That's the end of the month. The others have resolved. So happy with that. So the county will be money. We have new FCC on board. I will be meeting with him right after.
A new what?
Family Court Commissioner,
Oh, really? Yeah.
Who is
TJ Duffy.
Number 9, District Attorney's report. See a District Attorney. Moving on to number 10, Child Support. We do have a report, but Madam Director is present with us as well. Is there anything you wish to highlight?
No.
Any comments or anything to share?
No.
Is there any questions for the Child Support report? Chuck, any questions for Ms. Okamoto?
No, thank you.
Thank you for your report. Moving on. Number 11, Sheriff's Department.
Well, I'm able to be here because my jury was canceled. I have jury duty this week. So the only thing additionally that I want to mention is we're coming to a close on the bear hunting season here. We have had some calls, especially in southern Sawyer County, and dealt with it. It's been pretty good this year. I don't think the calls for concerns were above normal or that much above normal, and they were dealt with accordingly, and things have seemed to go pretty well accordingly. So with, at least with the hound hunters and the people baiting bears, that's obviously where there's a big conflict, is the two groups there. So with that,
Chief Deputy.
Communication Center report. We've been meeting with CenturyLink to finalize our 911 grant. It's part of the Next Gen 911 grant for our portable 911 system. So those have been weekly meetings for the last couple weeks. So we have to get this finalized as part of the grant by the end of the year. So Corey's been working with Pat Sanchez Emergency Management regarding our county's emergency alert system, which is Nixle. Sounds like that contract runs up in July of 2022, so they'll be looking to either extend that contract or work with another vendor. We met with the clerk of courts. They kind of initiated a new software program called Citrix ShareFile, which basically is going to share files from the clerk of court's office to dispatch center and court services. So they'll be sending these warrants and warrant cancellations and everything over electronically. So good part about the system, it's got a workflow so they can kind of track that things are being taken care of on that end. So two of our part-timers that were in training completed their initial training. So they'll be working as second dispatchers for the next 10 shifts or so before they'll be expected to work alone. And we currently have had 4 applicants for part-time dispatch, which of 3 were chosen, and we'll set them up with shadows here shortly. Basically, they come in, sit in the dispatch center for a shift or 2 shifts to, I guess, just to see what it's like and if it's really something they want to do. Call volume, total number of calls received is down considerably from last August, so that's a good thing. And their calls for service was 1,837.
Any questions for the Chief Deputy? Chuck, any questions?
What do you attribute the difference that you're getting some applicants?
There's not a lot of interested people out there. And whether it be patrol side, the jail side, or the dispatch side, we're just not getting the number of applicants or the quality of applicants.
But now that you have you had several interviews for dispatch, what did you do something different, or is it that it's changed with the government of what's going on with and whatnot?
I don't know. I think it might be.
He thinks you got an increase. Do you have an increase in applicants?
Well, since the last time we put out for applications, this has probably been our biggest in dispatch. Jail still suffers and patrol still suffers. So.
Right.
I think there's probably a little more social media content out there. You know, we had some radio announcements out there for public notification that we're taking applications, our county website, Facebook. You know, and a lot of it's going to be word of mouth too throughout the community.
Chuck, any more questions?
I do not, thanks.
Lieutenant?
Our patrol call volume for our patrol deputies increased quite a bit there from the previous month, and actually from this point last year. We had our first fatality for the year, unfortunately, happen. It was up north of 6 Mile off of Double N. But compared to our numbers last year, it's still very where we want to be, where we would like to be. The Wisconsin Box grant, Bureau of Traffic Safety seatbelt grant, the fiscal year has ended, end of September, so we're closing out that grant. There was a number of monies that we will be giving back to the federal government for shifts we could not fill due to staffing, a lot of it. But we will have the final numbers and tallies of all of our contacts from that grant and be presented next month at the report. You can see our citations there, our crashes to date. We also had a number of community events that we went to, including the Extra Trout Fest, the Fat Tire, both successful, and our SWAT team members worked with the Hayward Community Credit Union and did a outreach over at Fall Fest, which the public got to dunk a couple of our deputies into the dunk tank. Our part-time deputy has started his FTO track, is tracking well. He's well on his path. We did have a second applicant we were looking at. However, that person accepted a conditional offer for full-time employment in Vilas. So we won't be proceeding anywhere with that applicant, but we'll still be taking applications in the meantime. So,
Any questions for Lieutenant Pinsky? Chuck, you got any questions?
I do not. Thank you.
Moving on to the jail report.
Lieutenant Johnson is attending the annual Jail Administrators Conference in Green Bay, so he provided a report. I guess if there's any questions, I can try to answer them for you. He did put out an RFP for food service to the jail. We've got 3 responses. One is actually the lowest bidder is our current Summit.
That's up on the agenda. We'll cross that when we get to that.
Oh, I'm sorry.
So has anybody had a chance to review the jail report? Any questions on the jail report? Have we, or are we in the process of housing inmates out of county to address the staffing issues?
We still are, yes.
We are doing that. We're in the process of doing that. Do we have is there something that could be ready for possibly the county board meeting in terms of what that kind of cost is what that cost is for the jail?
Okay.
All right, moving on to, we get a communication system specialist report. Assuming our communication specialist report is not communicating with the committee, so maybe we should figure that out, see if we need that or not.
Yes, we do have that. It's not the one right there. We got it late, so it's now on the board.
All right, well, you guys got it. All right, so number E is the proposal from the jail for the inmate food service proposal. It's for discussion and possible action. I'm assuming the action is to approve it so that it can move forward for negotiations, or is this the offer that the jail has for food service for the amount of time? Anybody want to talk to that one?
Yeah, this is our procurement process. They did an RFP, as he was mentioning before. And so the responses that we get, the recommendation coming forward, they'll discuss that, but it's just a normal process going through. We're bringing it to committee just so that you're aware that that process was followed and have you look at it. But it doesn't need to go to the board for approval, but we bring it forward to you so you know that it's been properly procured.
So the board still, the full board needs to approve it, but it comes to public safety because that's the committee of jurisdiction and then it goes up.
It doesn't need to be approved because we did follow the approved procurement process.
So the jail allocated and used what, county funds or something, and then this is just the notification to the county board that this is the process and this is what's been happening.
This is the food service vendor that will be providing that service.
So what would be the action that would be needed for the committee, just to review?
Just review,
So
just for your information.
So it should be just next time, just information only.
Yeah, I mean, if you wanted to take action and approve, you could, but just so that you know that.
Well, I'm afraid if we don't approve it, then what happens? The county board doesn't approve of the contract that's already been put in place. I mean, it's just creates a little bit of.
I agree, we should approve it, because it would come to this committee.
Well, it's coming to this committee as information, so with the action
But
is,
that's what it ain't saying there.
I know it's not saying that, that's my.
Possible.
All right, here's what I will do. So we have a proposal that is being afforded to the committee for information only on some kind of review basis that they the jail went through its procurement processes, which is a county process, and secured the contract. I'm assuming the contract is secured, right? It's locked in, it's done.
We are still under current contract with Summit Foods.
So what does this contract do with that?
Well, that contract comes due at the beginning of the year.
So this is the start of this? Guys, come. Someone walk me through this, because I don't want to create more problems, but I don't want this to.
The food service contract, so that is a contract that expires at the end of the year. Rather than just renew that contract, we did a request for proposal to see if there were other vendors that could provide that service at a lower cost or better service. So they reviewed the 3 responses that we got and selected a vendor, which happens to be the same vendor, which is fine. So then we will sign the contract with that vendor for the following year, food service for the jail.
And that goes in effect January of next year.
Yep.
And so it's on this agenda for what purpose?
Because there are times where the board says, well, you haven't, we haven't seen that agreement in a while, so we're bringing it forward so that you are aware that food service here, and that's the system for it.
So Chief Deputy, what would you like from this committee?
I really can't answer that question. I'm reporting for Jeff, but he was instructed that we should do the RFP to follow county procedure.
Right.
Which we did. I don't know if it needs this board's approval, does it, or this committee's approval?
Not necessarily because of the procedure was followed. Again, we're just bringing this forward for your information. You can approve it if you like. We can proceed. We just wanted you to be aware and make it transparent.
All right, so is there any questions regarding the food service proposal that's being offered by the jail to the board? Mr. Bennett, do you have anything?
I would just make a motion that we accept this as information only and put it in whatever we do with that.
I have a motion from Mr. Bennett. Do I have a second? Do I have a second? Do I have a second? I do not have a second, Mr. Bennett, and your motion fails for lack of a second. Is there any other questions for this report? Hearing none, we're going to move on. Congratulations and good job. Moving on to number F, Cooperative Law Enforcement Agreement Review. Discussion only. So, is this the annual discussion for, is this the Cooperative Law Enforcement Agreement with the tribe?
Yes.
Yes.
This is the current one.
All right, guys. Who wants to take the lead on this one?
We can share.
We can tag team on this one.
Every year it comes up for renewal. The big thing is changing the data and statistics in the last year, and that's done mutually with LCO. Most of it done with the tribal police department there. TGB gets involved a little bit with some of the data there, and we take care of our end of data collection and putting it in the document accordingly.
Does this committee need to review the information that's being part of this agreement?
It's been brought before the committee annually previously. Last year, the big thing was referring the citations to LCO court. That was the big issue of concern or contention, if I may say. Outside of that, it's been a document that's just rolled over from year to year.
Is it your ratification or approval from this committee or from the county board?
This document here is just for review. The final document that will actually be submitted for the grant will be on the next agenda.
Okay. So do we have any preliminary questions for the Cooperative Law Enforcement Agreement from the committee members? Mr. Peters.
I'm assuming that the highlighted portions of this report or this agreement are the areas that are in need of change?
Correct. Most of that is just dates or statistics.
Yes, that's.
Mr. Schluter, got any questions?
No.
Mr. Bennett?
With that was done last year, or I guess this previous time when it came up that there we got some feedback or whatever that it was going to go through the tribal judiciary part. Did we ever have any issues with that, or was it just status quo? Everything was good, no problems?
Sheriff, do you have the ability to answer that question?
Well, it depends on how you define problems. I mean, it did add workload and responsibility to the process, and changed a lot in that area. It was functional and it did happen.
Any other questions for the sheriff or the chief deputy on this matter? All right, hearing none, that was for discussion only. Moving on to the animal control report. Shelby, the floor is yours. Did you bring gifts?
Pardon me?
Did you bring gifts?
I did not see gifts. Next time maybe donuts or cocktails or something. Soda. Just kind of a status quo month. I tried to play catch up with the calls from my vacation, so I was catching up. I've got some missing dogs. I don't even remember what I put on the report that I brought, the highlights. It was a little late getting in, so I do apologize, Madam Clerk. You can see licensing is still down, but that was substantially due to the lack of the vaccination clinic. LCO was going to have one this year, and Dr. DeVoe from the state of Wisconsin that usually does it had to cancel because of the COVID situation, so they weren't able to have theirs either. Impounds are up a little bit. I think out of the 10 that were impounded, 8 were returned to owners. There were 2 renegades that I think were dumped, and the Humane Society ended up taking them. So I think that's it.
All right. Any questions for our animal control officer? Chuck, any questions?
I do not, thank you.
Any final questions or comments for the sheriff's department? Hearing none, moving on to number 12, coroner's report. Committee has received a report. Is there any questions regarding the coroner's report? Assuming the coroner's not here, right? Everyone checks for the coroner when they get up, right? All right, no questions on the coroner's report. Moving on to number 13, emergency management. We do not have one, but I do have a question for Mr. Hoff. Do we have a strategy for replacement that Ms. Sanchez really fall through under threat of retirement?
Have not got an official plan yet, no, because we have not got an official retirement letter either. So pending that, we have had some discussions. Nothing permanent, yes. Yeah.
Right. Any questions about emergency management from the committee? Hearing none, moving on to number 14, criminal justice coordinating update. Essentially what the update is that there were some bugs in the system that were discussed and hopefully smoothed out. And the diversion program that had been promised is going to be implemented on a very slow scale, but there's going to be buy-in from the various stakeholders, the DA's office. I think there's going to be public defender's office, Justice Point. We're still running at above capacity for Justice Point in terms of the bond testing, and there's a concern about reallocating the resources. A TAD grant, was it submitted? It was submitted, wasn't it?
Yes.
So a TAD grant was submitted. It was altered based on the conditions that we had in the county. So it was submitted as a planning grant for next year instead of a diversion court. So we'll I don't know when we're going to hear back from that, but that will probably be available for the next update. So any questions on the CJCC side? We're done. Moving on, number 15, ambulance service department report. Dunstan, the floor is yours.
Alrighty, so again, staffing, we still have 3 open full-time positions, 2 advanced, 1 EMT. As I've said before, regionally, there's staffing shortages all over the place. One thing that we are really looking at when it comes to COVID related, we're waiting. So because of the vaccine mandate that the federal government has pushed, we're waiting for CMS, Centers of Medicare, Medicaid, to rule on what vaccination mandate means for healthcare workers. They're supposed to rule sometime mid-October. There hasn't been a date. How that affects us is who can decline it, who cannot. And why we worry about that is, of course, because they're the ones that give us the funding for Medicare and Medicaid programs. So all of those reimbursements are kind of up in the air a little bit. So I'm just putting that out there. We do have staff, you know, that are totally wholehearted against vaccination, which have said that, you know, unofficially that they might leave because of that. But that is every service. So this is kind of a big deal coming up. I did talk with the state on Tuesday. They have no idea what way CMS is going to rule, of course, and what that looks like. With that, I will address public comment a little bit with this.
Excuse me. Don't address the public comment yet. We want to get to the first discussion.
Okay.
Mr. Slater?
If somebody does leave because they are opposed or in favor, because somebody is strongly in favor, then they may leave because this person doesn't get the vaccine. But according to the mandate, if it requires vaccinations and somebody leaves because of that, they can't just go to a different county.
No. I don't know what that looks like, quite truthfully. I don't know, you know, right now, some of our big healthcare systems are doing, you know, you can decline the vaccine, you know, they have specific rules with that. However, CMS hasn't ruled. And so everything that they're doing currently might not be covered for them, you know. But I will say, you know, not taking Medicare and Medicaid funding reimbursements, you know, is crippling. It will cripple all of Northwest Wisconsin.
Yeah.
I've talked to other service directors. I've heard things like some services are talking 7 people leaving, you know, in already a short area, you know, and this isn't, it's unfortunate because everything that we've done for recruiting and retention and, you know, making sure that we have good staff and everything else, you know, that's the debate. And, you know, if you're for it or you're against it, what keeps me up at night is what do we do when we are that short? And so, you know, the question was posed with the state is that, you know, like minimal staffing, you know, throughout this whole COVID thing, we've been trying to figure out, okay, what is our minimal staffing here in the county? We have always kept it at two staff trucks, 2 people on a truck. That's minimal in the county. State says 1 for your PSA. Now, Monday, we had 8 calls in Hayward alone. And that was with 2 trucks. So I don't know what going down to the state level of 1 truck will look like for us. You know, and that's where mutual aid, well, if they don't have anybody, then what do you do?
I think it will look like a very dangerous situation.
Right. Now, our rep, Don Klemenka from the state, he did state that he kind of thinks that it's going to be more facility. It won't be so much pre-hospital. It's going to be more nursing home, healthcare facilities and whatnot. But he doesn't know that for sure. That's what he's hoping. But again, and we don't know who that enforcement agency will be either. You know, if it will fall on the state to do that enforcement, we don't know. So this is where breaking the backbone of EMS is, you know, could be days away.
All right, so let me add this because this is an issue that clearly has been discussed more than once, and I don't quite have a full grasp as to what's happening. And I don't want to get stuck with the public arguments about what's going on. So let me understand this and correct me as I say these things going forward if I'm incorrect. The federal government is going to attach federal dollars to agencies receiving that federal dollars. If they have people who are not vaccinated, they will not offer those reimbursements or those payments for their services.
Yes, and that's what it sounds like.
Okay. That sounds like, or is that what is that?
We don't know yet. We don't know. They're still deciding on that.
And so we have state employees or county employees who are being directed by the federal government in terms of what their vaccination determinations are. And so the federal government, if county or state employees don't respond to that federal mandate, then the sanction is no funding, or is there another type of punitive action that's being offered? And Rebecca, I'm gonna say something that's gonna pull you in here, so get ready.
We don't know yet.
All
We
right,
don't know
so,
if it will be on like the insurance reimbursements for each, ride time. That's what we're looking at. It's just the payer mix of people's insurance.
so has the county or does your department, and Sheriff, I know that you have a position on this already, so is there any emergency or public service thing that's operating under this committee's jurisdiction that has a rule or requirement that if they're going to be an employee of that entity, that they have to have a vaccination?
No.
And we don't have any other kind of specific requirements. There's no professional credentialing. There's nothing else that requires that a vaccine be administered to an employee in order for them to perform their duties.
No.
So you have people who are threatening to leave CMS because the federal government's telling them that they have to get a vaccine. All right, so here's my issue with this one is because Medicaid and Medicare funds are not contingent upon the performance of an employee. It's contingent upon the relationship between the agencies and the actions that's already been done. It's a reimbursement for services already offered. And so if we've got employees who are hired from a state or from the county that don't have those kind of instructions, but we're going to carry a financial penalty if we don't comply with a federal one, I think we're looking at a lawsuit because that interferes with the ability of the autonomy of either a county unit or a state unit in terms of being able to do it, to meet its either constitutional responsibilities, which to me, a constitutional responsibility trumps any kind of legislation that's going to come down from the federal government. And secondly, there's also a county and the state have the same constitutional requirement to the state. Here's what I want from this, and this is what I'm going to ask the committee for this. I want a motion from this committee to advance this for a discussion to the full county board. And we either need to come up with a resolution or some kind of assurance that our employees, county employees, are not going to be penalized if they exercise their right to not have a vaccine. Because I think it's wrong that someone from somewhere else is going to direct a person in how they're going to take care of their body. And if that's going to impinge upon our ability to provide our services that we have without this kind of COVID kind of interference, that needs to be addressed. And we need to give assurances to our employees that if they're going to exercise their constitutional right, the right to decide what they're going to do with their bodies, that they're going to have the county behind them as much as we can. And if we have to go without forego federal funding, then so be it. Anybody want to do that? Come with me on that trip, Chuck?
I do not. And the reason I do not is because not that I agree with everything you're saying. We're all speculating and we don't know that they are going to do it. And we're all getting ready for the worst case scenario. So until something is done, because I don't foresee this happening, I think we're wasting our time.
I agree. This is too early to start this process. We're going to be, Chuck's right, we're going to be wasting our time discussing it back and forth, maybe even arguing back and forth. You said we need to support their right to do what they want with their own body. We're going to have people saying, well, that is a problem because the body next to them may depend upon their having the vaccine. Whose body are you? It's just a hornet's nest. It's way too early to get into that. It'll probably be on something higher than the county level if there is a lawsuit.
Mr. Peters, got any comments or?
I agree with Mr. Schluter on that. I'm cautious about making this move at this time.
Mr. Buckles?
I agree with the rest of them. It's just too soon. We don't know what's going to happen.
I guess I got dressed up for that. All right, Mr. Dunstan, continue with your report, sir.
Can I just add, so we're all waiting, all the healthcare agencies are all waiting on this. It's supposed to be mid-October that they publish or put out their findings or whatever. I know, WCA has put in their magazine about the nursing homes a lot of counties operate, and so they're looking at it too. So, I just want to put that out there. It affects lots of different places too. So, we're still dealing with a continued regional bed shortage. some new trainings. We are still in that process of trying to complete that pediatric training on our new hand heavy system that I was talking about last time. Other than that, we did state ambulance inspections with DOT on last week, Wednesday, I think it was. We just had one issue with a parking brake that wasn't holding, so that is being resolved. Other than that, that's all I have for you guys.
All right, so Mr. Dunstan, at the last meeting, you were present, but Mr. Hoff, I actually asked you to confer with corporate counsel to see about what the policy implications would be in drafting something in response to what Ms. Ladenton had presented. I think it was at the August or July meeting. And so for Mr. Dunstan response, we do have a public comment that came up. And so do we have an update in terms of where that process is at?
We've had some discussion on that. Rebecca, do you want to come up and help with legal ramifications of, and could you restate the intent of?
Probably not. August was a long time ago. July was a long time ago. Well, Ms. Roker, you've probably heard what the request is, right? And so we had an incident that happened in July. And Louise, I don't want you to think that we're not taking this seriously. This is just, you're teasing me because I'm an old man. So we had an incident where there was a call for assistance, and the assistance that was offered was delayed because the services and the resources that we had were stretched. And so there was some looking into in terms of where those services were allocated. And fortunately, nothing fatal came from that, but there was a request to look at that to see if there could be a review or a review of the policy to find out if there could be something could be done to address community resource allocations and responsibilities while also maintaining an adequate level of response to diminish the response time and something along those lines. So I'm paraphrasing a little bit from July and from August. This committee reviewed that. There was some discussion about what that meant. There's a concern that we don't draft policy based on specific instances because we don't get a very valid or very carefully planned out policy. But we also wanted to make sure that this could be examined to see if there was a need for a change because the thresholds were met, whether or not this warranted any further change. So Ms. Roker, the floor is yours.
Sure. After the last meeting, as you indicated, Mr. Dunstan had prepared essentially the response to that really, from my perspective, encapsulates what the county's policy is at this point in time. And I reviewed that, and it meets with the statutory requirements for the county's policy. So from a legal standpoint, I think the county is meeting its legal requirements in its policy. So the next question is really your policy question of whether you want to have additional details in your written policy regarding those reallocations. And it was my takeaway from the last meeting as to whether that was legally possible. And it is, but from my perspective, again, the answer is the county is already meeting its legal requirements. And I think the key, and Mr. Dunstan pointed this out, is that it specifically has an operational plan that's required under the Wisconsin Administrative Code. And that is in compliance. And so again, from my perspective, that's the most important factor, is that what you have in place already is already legally compliant. Now, in terms of if this committee would like to go forward with some more specific reallocation language, I would look to Nate to either put that draft together and then I can review it. But again, that's really a policy decision from this committee as to whether you want to dive deeper into your policy and have those provisions included.
Thank you. Mr. Director, this is your opportunity to respond to the information or your ability to add to whatever you want to the record.
Like I was saying in the conversation with state, because I did ask, the state statute for the requirement for the minimum. And we went through where you looked at the operational plan that was submitted, because every time we have to resubmit a new operational plan to the state. Supposedly, we're gonna have to do another one here in next upcoming months, weeks, because they've rechanged the operational plan layouts. But Don Kamika's thought is that we are in compliance. Like he said, the state is not gonna require any more than one EMS unit per PSA. You can do a transfer, you know, with your other units. Department wise, we always keep 2 units in the county. That is our minimum. We can change that if you guys want to, but then again, you're gonna need more staffing, you know, and that would be a little more full time. So our minimum is always 2. State's minimum is 1. Transfer wise, you know, you can kind of keep an eye on the numbers. The transfers are going down. We're still doing quite a few out of Ladysmith, and those are getting longer and longer. Weston, Marshfield, Maine, but otherwise that's all I have. And if I can add 2 during this point in time is that we had an MCI now, or a mass casualty incident. I did talk with Don about that too, and he said, yes, all of your resources are going to be utilized for that. Now, for this particular incident, even if all of our trucks were in the county, okay, not saying that all of them would be staffed, but if all of them were in the county, at that point in time, we would have 3 staff trucks. They would have still gone to the other incident.
Right. Is there any comments from the committee members first before I open to the floor? Mr. Schluter?
Yeah, again, I think we might be jumping the gun by responding to one particular incident. And especially in lieu of what's going to happen or may not happen for the same reasons that we turned down your request for a motion, I would use those same reasons for this. It is premature to start, and especially if this new plan is going to be due in a couple of weeks or months, don't make him do one total revision now and then another total revision in a couple of months. I think we need to wait and see this out. The other thing that concerns me is we could have triple the number of ambulances available and staff available, and there's still no way we could guarantee that a situation that happened would not occur again. We could have quadruple 10 times, and there's no way we could guarantee it wouldn't happen again. So I think this is, I don't think we should go anywhere with this.
Mr. Peters?
I guess I have concerns that when we do have events that pile on top of each other, that decisions have to be made. And I don't see how we can predict exactly how many ambulances we're going to need. The issue of having transfers out of county are important to the people who are being transferred. If there is mutual aid available, I think it should be called upon to address the kinds of issues that came up on that particular date. I personally would agree that the time lag was extremely, at the very least, extremely unfortunate. And what would would have happened if there had been a more serious outcome to that event? I'm at a loss of where to go on that. That's where
Buckholz?
I agree with Mr. Schrader that we should pursue it more right now. It's just a one incident thing. And I know it's unfortunate that it happened, but we'll take a look at it later down the line.
Mr. Van Etten?
I think everybody's, correct. If we start to put it in perspective, we have fire stations all over and we get 2 major fires. Obviously, that would stop us, or law enforcement for that general. You get an armed robbery on one side of the county, on another on the other. You try to be ready, but at the same time, we can't afford to have 6 ambulances standing by for the what ifs. So I think, again, this was an unfortunate situation. It just hit at the wrong time, at the wrong place. So I really don't think we can do much about that.
So my view on this would be I share the same thoughts. And the first thing I would say is I'm really thankful that this wasn't a fatal incident, and that, Ms. Ladenton, that you had people that were, privately trained to be able to address the concerns for your grandchild. And
That's not true.
you don't have people trained for that? I thought there was people that was taking care of
The only
it.
reason an ambulance was called was because the ambulance service provides pain control.
Oh, pain control.
And it was not available. And so the child had to suffer 5 hours of severe pain because there was no help available. And it was my understanding that even if an ambulance wasn't available, a paramedic would be in a fly car. We were told nothing was available, and then we were told we had to wait an hour and a half.
Right.
And that's the sum total of our service requests.
So that turns on the issue specifically that this was an incident that happened that was unfortunate in timing. So I mean, here's where my concern would be, right? And it's, if we had 7 ambulances or 12 ambulances, I don't even know if we would even maintain those, because we've got surrounding counties that are already dependent on our ambulance service right now. And so mutual aid requires us, and then there's a listing or a priority listing of different instances that require emergency responses. And so it's unfortunate that you have the personal connection to the incident that we don't, but no one here doesn't begrudge that because they understand what you're doing for your family. But the larger concern is what is going to be the fiscal and the commitment that we have, and the county is doing the best that it can with its resources that it has. And so if we were to change the policy, I don't know what the fiscal impact would be. I mean, we got some we got different concerns that are going to be thrust upon the county that we're going to have to respond to. We might not even have what we currently have in place. So it's the position of the committee that the policy remain in place, and that and if we'll review it when it goes to the annual review, and that it's the feeling that I have based on the information I've talked with the different people, that we examined this to find out what was going on. It was an unfortunate incident, but we don't have the ability to address it. We don't want to do a knee-jerk response to every single incident. So with that, do we have any final, before I open this up to I guess I'll open up to the floor, Mr. Hoff.
Yeah, thank you. I just wanted to take it from a little bit broader perspective. Nate talked earlier about, some of the things that we're dealing with, with the mandates of vaccination possibly, and some of these other things. But if we look at it more globally, Sawyer County is positioned very well in the ambulance service that is provided in this county. I was at the Wisconsin Counties Association meeting last week, and one of the sessions there was about countywide ambulance services, because there are other areas around the state that still rely on towns to provide ambulance service for their citizens, and they struggle to get people, to get ambulances, to get professionals to do that. In Sawyer County, way back when, you decided to take it upon yourselves to do it as a county, and the state statutes allow us to do that, and other counties are doing that as well. And it has afforded the people within this county an excellent service that's provided that is hard to replicate, town by town by town in other counties. we talk about countywide services, I think it'll probably morph even more into a regionalized service rather than just county boundaries. And we kind of see that already, where we kind of bump out into Washburn County and some other things like that. So I think you should be proud of the service that's provided here. You do have the options of changing your policies, obviously, but you know, the service we have here, I think, really enables the citizens of this county to feel comfortable that they can receive service when needed. Other counties don't have that luxury.
Any other comments from everybody else, from non-committee members? All right, that brings that item to a close. Moving on to number
Mr.
17.
Chairman,
Madam,
if I could repeat my original request, it wasn't for a complete policy change. It was for a policy to be created on days that were known ahead of time to be extremely busy because of the added events in our community. You know, Hayward has a world-class place with world-class events like the Lumberjack Championship. At that day, there was an ambulance committed to that, and it was known ahead of time. There was an ambulance down for service, known ahead of time. And there was another ambulance someplace, I don't know, not staffed or something. I don't know. I can't get an answer yet. There's supposed to be 7 ambulances, but there wasn't. There was only 3. Of the 7 available, 2 had been assigned knowingly by the duty officer, whoever that is, and I still haven't figured that one out, to out-of-county transfers in the morning, knowing that those other units weren't available. To me, that was a poor decision, and my request is that this community of concerned public officials be aware of that who is making those decisions, and create a policy so that those decisions then take into consideration that day and anything else known ahead of time. And certainly LWC is known ahead of time for next year already. We know what day it's going to be. We know there'll be an ambulance committed, just like the Berkey and every other day. Then why on that day would they commit to 2 out-of-county transfers? And yes, I know you meet the minimum requirement legal by the state plan. I used to write the ambulance plans for years for this county, and it is not reasonable to expect 1 ambulance to cover 1,500 square miles, regardless of the number of people there. So my request to you was not for a complete revamp or that people get vaccinated. My request is only that somebody be reasonably responsible to make those decisions. And apparently no one was. And then to add insult to injury, if there's an MCI, how many people were involved in an MCI? I can't even find that out. Everything is redacted on the reports I requested. It doesn't even give me the number of people. Who made that decision? I can see one tiny line in the report I received that it says Sawyer County Dispatch requested 3 ambulances to respond to an MCI. That's all I got. Why would Sawyer County Dispatch make decisions about how many ambulances go to an MCI? Are they trained? Are they the duty officer? Who's the duty officer? All I want is answers, and I want to know that my family's going to be protected and get some help when my tax dollars are paying for it. And yes, I know the people out of the county need transports to other hospitals, and my heart goes out to them, but my tax dollars don't support your crew, your resources, your ambulances to go to Park Falls and take a patient someplace else, or to go to Spooner and take a patient to someplace else. They support my family here, my friends, my relatives. And all I asked was for a simple review of who's making that decision, and that this county, you're responsible people, you are responsible to that department, that you make a review of that. And so far, all I've heard is that you need the requirement by the state legal guideline. That's not reasonable. In anybody's mind, that is not reasonable to think 1 unit can cover the whole county. That's not reasonable. Yes, it meets the state CYA, but it doesn't meet your CYA, in my opinion. In my opinion. So let's clarify the issue. I do not care whether you have a vaccine or not. I only want help to come when it's needed reasonably. I would even settle for 45 minutes. But a half an hour, hour and a half, or not at all is not reasonable. I just want to make sure that everybody here understands that I understand that you're smoking me, and I don't like it. My tax dollars pay for service. When I call, how many times in my lifetime have I needed an ambulance? How many times has it come? Since the current administration, and I'm not including Nate, I'm talking about the paramedic service. How many times do you know that an ambulance is needed and it doesn't go? You still don't even know that. This county doesn't, this committee doesn't even not know that. Nate's report does not include request for service that is not met. I don't even know that. I
So-
only know one time that it
Louise,
happened
I'm gonna
because
interrupt you
we were
because
on the phone.
Right.
I
My
understand that
3 minutes
you're,
are
all
up and I'm done. I'm done.
right,
I'm done. And you can blah, blah, blah to death, and I won't be satisfied.
all
And
right.
I told
That's
you,
exactly.
Then your comments have
right.
been taken, and your comments are
no, they
noted,
haven't.
and
No, they
we're
haven't.
moving forward. Thank you.
I'm not satisfied in any way, shape, or form. I'm going to the media with it. If they'll hear me.
Moving on to number 17, future agenda items.
16.
Oh. That's dramatic. All right, going to number 16, 2022 budget requests. Oh, we have any budget requests? Does the committee have any budget requests for the 2022 budget for Sawyer County? Mr. Hoff, you want to open the door on this one?
Thank you. We have this item on each of the committee agendas. We've been working through the budget process. The budget that will be presented is being wrapped up. So Mike has got some information about the departments that are represented under this committee's jurisdiction, just to see if you've got questions, to make sure that you understand the budgets for, the departments listed under this committee. Because as you get into the county board as a whole and have discussions about any changes that you understand, the commitments made under the budgets here. So I'll let Mike just kind of briefly touch upon the departments here, and then we can open it up for questions or comments if you have them as well.
So in your packet is a report called Public Safety. And it's a very detailed report of all of the departments and budgets that should be within your jurisdiction. It's kind of in department order. I'm not going to go through all of these budgets line by line. If you have questions, I'm happy to answer them. Other than to just kind of point out the report a little bit. The second column in says 2021 amended budget. That's the budget that we're operating under for this year. The next column over says 2022 department. That's the budget or the numbers that the individual departments requested when they were filling out their budget. And then the final column, 2022 administrator, represents the final budget per the county administrator that he is going to ultimately submit to county board for county board to take over control of the budget. So if you look at the difference between the 2022 department and the administrator, as you go through the lines, if you see changes, it's because county administrator has changed that particular line item up or down for whatever reason.
So let me just help me understand this.
Yep.
This is going to be our play sheet going forward so that our agencies that we have that report to us, we are prepared to go for the full board discussion to defend the budget allocations that we have that's going forward. And that there's been budget modifications, then it comes from Mr. Hoff kind of advise us as to why one is up higher or lower than it was for the previous year. Is that fair?
Yeah, this is the budget that, in my estimation, best allocates the resources that we have. That then becomes your budget after the publication of this budget, the administrator's budget. It becomes the board's budget, and then you can make changes. So making sure that you understand what is in this budget, because other members who are not in this committee will need to understand, some of the, we just heard a citizen in some of the services. Are those the right services we want to provide, and the resources allocated accordingly?
Mr. Schluter.
Yeah, you scared me a little bit when you said it's our duty to defend the budgets of the departments that hear us. When I first got on this county board, there were county board members who fought tooth and nail for this department's allocation. There were county administrators who fought tooth and nail for that department's administration request. And it was a mess. Nobody was thinking of the entire county as a whole. We're finally getting around to that. I don't want to go backwards. Yes, we can defend a budget request by recounting the reasons why there's an uptick in this particular line or that particular line. And that's just disseminating good information for further consideration. But I really, it scares me when somebody says, we're going to defend our departments. We need to remember we're working on the entire county budget for the entire county and not for any individuals, not for any other than everybody.
Well,
holding
I
together.
say that because, I mean, as we've gone through this budget exercise the last, 3 or 4 years, we pass a $31 million budget. What we fight about is $25,000 to the convention bureau, or we fight about $20,000 going to the library, or $200,000 going to the library, or something else. And so we want to make sure that our major agencies have the assurance that their budgets are going to be as they've requested, or at least as they've understood them. And that's where the infighting comes from, is because we've got non-committee members who are loyal to roads. Roads is going to want more money for snowplows or for budgeting. We're going to want to make sure that we've got staffing for jails. We're going to want to make sure that we've got staffing for our deputies. And if we don't maintain that, then we're telling our deputies, you know what, Lieutenant, you're going to go back on the floor with 5 less deputies. And so then he's got a larger responsibility with less. And then we're going to have a lot more citizens coming in and saying, well, this is what's going to happen to our services. I mean, Nate's going to get this request down for 15 ambulances. And so it's important that we understand what our responsibilities are, because that's why we serve on these committees, so that we have the understanding that the rest of the board isn't going to have it, so that we can educate and then respond to these different areas. Because I'm going to be concerned about finance and their allocation for a library service for an increase in funding, when I'm listening to, funding shortages for, ambulance supplies or jail supplies, or we've got this budget thing for food. And I'm not going to get lost in the weeds on that one, because these people rely on us in our leadership positions to defend what they're doing so that they have the job going forward. And this happens. And if it's an ugly process, then this is the work that we've chosen. We made a commitment to stand up for this, and that's what we do. So I appreciate these budgets, because I know that over the years, that since Mr. Keefe and Mr. Hoff have been here, the budget process has gotten a little bit more cleaner or more understandable, because it's never always been that way. And it used to be, buffet style, and everyone get to the table, what would be grabbed would go to the departments. And so we're getting better at it, because we have a better organization going forward, and I have faith in them, but I still have responsibility to the committees that I'm responsible for. So that's my response to that.
Just one quick comment. As you're looking at these budgets, you might wonder, well, what's the impact on the levy from this year to what we're projecting for next year? You would want to look at the 2021 amended budget column, and you would want to compare that to the 2022 administrator column. Those up and downs are what the impact is on the levy, whether it's up or down. So those are really the important columns. I could just say overall, there's an operating budget and there's capital budget. The first probably 28 pages of the report in your packet is operating budget items. Public safety wise, operating levy is up about $90,000. 32,000 of that is ambulance, and the only reason I point that out is because ambulance is outside the levy limits. So 32,000 increase in ambulance is outside the levy limits. The other $58,000 of public safety departments is within the levy limits that's the impact to the levy for the operating side. Capital side, the last couple pages are capital related. The levy is up in the capital side for a few reasons. In 2021, we did not purchase an ambulance. 2022, we are budgeting to purchase an ambulance. So their capital levy is up. Again, it's outside the levy limits. And then there's some sheriff equipment that came in that we've allocated some money to that was available. It just increases the capital levy, but it fits within the budget numbers.
Any questions for Mr. Keefe? Chuck, you got any questions on the budget?
I do not.
Any other comments for Mr. Hoff or Mr. Keefe on the budget process? So you need a discussion and possible action. What do you need from the committee?
No action today. It's informational again. We're doing this in each of the committees, so if there's questions, concerns about the budget, suggested changes, you can start thinking about those. You know, this will be the budget that goes forward to you, and then if there's changes in what's being proposed, you'll have that option as we go through the public hearing and the subsequent November adoption meeting. So we'll have a fuller discussion at county board as well with the whole group together on the overall budget. So that'll be presented at county board. And then at that time, you can make changes as needed.
So like fun.
It's never fun.
Any last comments for Mr. Hoff or Mr. Keefe? Hearing none, moving on to number 17, future agenda items. Is there anything that the committee wants on the agenda for November's meeting? Hearing none. Number 18, any reports or correspondence from conferences and other matters for discussion only? Mr. Schleter, do you have anything you wish to add?
No.
Mr. Peters? Buckles? No. Mr. Van Etten, speak now or forever hold your peace, sir.
Yes, sir. I brought up at the last county board meeting about possibly changing this. I would also like to note in the year and a half I've been on the board, the district attorney has never been at the meetings. And when we had discussed this about a possible change of time, it was said that, well, we got to get with all these committees if they're not showing up. So I don't know. I don't know where we're at with that, if we can still make a possible move.
So what was offered at the last county board meeting was to change the meeting time of this committee from the morning to the early afternoon or late evening or early evening.
5 p.m.
5 p.m. And so Mr. Hoff was tasked with exploring that option, and Mr. Hoff is yet to provide his response. So I'm sure he's still investigating that at the various departments. The concern I would have is that that might put some people in overtime, and it's going to probably interfere with some childcare concerns that they probably have, because I know that there's this need to pick up children at a certain time from certain facilities and whatnot. So that remains. We can put that on for a future agenda item for discussion to see if that's something that's still viable.
I'm willing to move to like 3 o'clock. That would be better in the afternoon.
Okay, so we'll just put on a alternate meeting time for public safety for next month's agenda, and Mr. Hoff will have the delightful opportunity to have that discussion with the department heads and see what they feel and think. Anything else for the committee? Anything else from anybody else? If not, this meeting is adjourned. Thank you, everybody, for participation this morning.
Want to set a meeting for November, or-
Good day, Rebecca.